Which is the best treatment for ADHD, medications or therapy? Well, today we're going to be answering that question by discussing one of the top research studies to ever have been conducted on children with ADHD. And the results are something that I truly believe every parent of a child with ADHD needs to know about. It's that important, so stick around. In December 1999, the Archives of General Psychiatry published the Multimodal Treatment of ADHD study, which is commonly referred to as the MTA. And in this landmark study, researchers evaluated the safety and efficacy of medications and behavior therapy for ADHD. This study included nearly 600 children ages 7 through 9 with a diagnosis of combined type ADHD. The other thing that sets this study apart is that they did not exclude kids with comorbid diagnoses. So kids could also have things such as oppositional defiant disorder, conduct disorder, and learning disorders. And this allows for the kids being studied to be similar characteristic-wise to the patient populations that we actually see in clinic. And this makes these study results more translatable to what we see in real life. So there are three main questions that researchers were trying to answer with this study. And they were: 1, how do long-term medication and behavioral treatments compare with one another? 2, are there additional benefits when the two are used together? And then 3, what is the effectiveness of systemic, carefully delivered treatments versus routine community care? The way researchers went about trying to figure this out was by separating the children into 4 different treatment groups for a period of 14 months. Group 1 received intensive medication management. Group 2 received intensive behavioral therapy. Group 3 received a combination of both intensive medication management and behavioral therapy. And then Group 4 received just traditional routine community care, meaning that the kids basically just saw their typical outpatient provider during the course of the treatment study. Something that I want to break down real quick is the intensity of the behavior therapy that was provided, because it's unlike anything that I've seen before. It was truly the grand slam of therapy services. It included parent training, child-focused treatments, and on top of that, school-based interventions. So the parent training included 27 group sessions and 8 individual sessions per family. The kids then did an 8-week, 5 days per week, 9 hours per day summer treatment program that focused on things such as behavioral interventions, social skills training, and problem solving. Then on top of all of this, the school-based treatment consisted of 10 to 16 sessions of bi-weekly teacher consultations and 12 weeks of part-time behaviorally trained paraprofessional aides working directly with the child. This is truly the max dose of behavioral treatment that any parent or child could ever participate in. Now, what factors did the researchers look at? The 6 major outcomes that were evaluated over the course of the study included: 1, ADHD symptoms. So we're talking about symptoms of impulsivity, hyperactivity, and inattention. 2, oppositional and aggressive symptoms. 3, social skills. 4, internalizing problems such as anxiety and depression. 5, parent-child relations. And then 6, academic achievement. All right, so let's break down what researchers found and answer question number 1. How do long-term medication and behavioral treatments compare with one another? And this is huge, okay? Researchers found that medications were more effective than therapy for the treatment of the core ADHD symptoms. And I want to just highlight this real quick because ADHD is one of the very few psychiatric diagnoses where medications have been proven to be more effective than therapy at reducing symptoms. So these were really big findings when this study came out. And then don't forget, there were the other 5 non-ADHD outcomes that were also evaluated, and what they found was that medications and therapy were not significantly different from one another. Now, question number 2. Are there additional benefits when meds and therapy are used together? So in short, the answer to this is yes. Combination treatment was found to be more effective than just behavioral therapy in treating ADHD symptoms, oppositional and aggressive symptoms, and internalizing symptoms. Not only that, reading achievement scores of the kids were better as well. Therefore, right, it could be presumed that adding a medication to a child who is already receiving behavior therapy can lead to even more substantial benefits for that child. And then question number 3, did those assigned to the 3 MTA treatment groups show greater improvement than the kids who were receiving community care. What they found was that those in the medication treatment group and those in the combined treatment group had superior results when treating ADHD symptoms than those in the community group. And what's shocking is that those who received just the intensive behavioral treatment did not have superior improvements in the symptoms of ADHD when compared to the community group. Again, demonstrating that medications are more effective than therapy alone when treating ADHD. Not only that, the combinations of meds and therapy was also better than the community treatment when it came to the other 5 non-ADHD domains. So the oppositional aggressive behaviors, internalizing symptoms, teacher-reported social skills, internalizing symptoms, parent-child relations, and academic achievement scores. So what are my thoughts about this study? The 3 main key takeaways that I want you to know is that 1, all 4 groups showed reductions in symptoms over time. However, when it comes down to treating those core ADHD symptoms, medications consistently outperform therapy. The study itself states that, quote, combined behavioral intervention and stimulant medication, which at the time was the current criterion standard for ADHD interventions, yielded no significantly greater benefits than medication management for core ADHD symptoms. Meds win over therapy when it comes to treating ADHD, period. The second takeaway is that even though therapy isn't as effective in treating symptoms of ADHD when compared to medications, it's still a very important piece when it comes to the overall treatment of a child with ADHD, right? Kids who received therapy in addition to medication were better able to get by on lower doses of the medication than those who just took the medications alone. And this helps with the tolerability and with reducing the potential for side effects. Not only that, most kids with ADHD don't just have ADHD, right? They have comorbid symptoms of depression, anxiety, oppositionality, academic struggles, and the list can go on and on, okay? So kids who received therapy often saw improvements in these secondary areas. Then the third takeaway is that stimulants were well tolerated for the vast majority of kids over the 14-month period. Only 4% of the children had side effects severe enough to cause them to discontinue the medication. And the most common side effects included loss of appetite, sleep problems, crying spells, and repetitive tic-like movements. So it's important to recognize that no single treatment is best for all children with ADHD, and you should always talk to your doctor when determining the best course of treatment for your child. Now, if you're interested in learning more about treatments for ADHD, make sure to click that top video.